Hospital is facing a whole new world under the new health care law, Allie.
And we could see big changes in how hospitals and doctors go about meeting Americans' health care needs. Dr. Marc Siegel, our Fox News Medical A-Team and Associate Professor of Medicine at NYU Langone Medical Center, is going to join us now to talk about, Doctor, there's this new report that hundreds of thousands of people are getting letters from their insurance saying that they are being dropped from coverage. This is exactly the thing that the president said wouldn't happen with the Affordable Care Act. He said if you like your insurance, you keep your insurance.
Allie, you got to read the fine print, because you're not going to get it in any of these ads or any of these press conferences. This is because if your insurance isn't from before the law, before 2010, it's going to have to be changed up if you have an individual policy to fit some of these requirements. Pre-existing conditions have to be covered, no lifetime limits, maternity care, preventive services. All this has to be in your policy. If it isn't, they're going to change you out, and you're probably going to get dropped by your insurer. Now, what's going to happen next? I guess you're going to have to go to those exchanges where you can't sign on, right? Where you literally can't even get through the red tape. Or you can go back to your broker and say, look, is there an ObamaCare ordained policy available? But this is a lot of red tape, and it is not what was promised.
But, Dr. Siegel, I mean, what the argument is that with the Affordable Care Act, with ObamaCare, you will get the benefits that you weren't getting in these subpar insurance coverage that you had. In other words, if you sign up and if you can get through the kinks, that your insurance will be better. Is that accurate?
That's actually very fair, Allie. And, you know, nobody wants the lifetime limits, and everyone wants pre-existing conditions covered and up to the age of 26 and maternity care. But someone's going to have to pay for that. And that means that the premiums of people who are very young are going to be used to cover those with more medical problems. And that's been studied by Kaiser Foundation in California. So, again, it depends who you are. You know, if you're elderly and sick, or you have chronic illnesses, this may be of benefit to you. But for a lot of us, it isn't.
Mark, what are you guys talking about with regard to Obamacare in the doctor's office over the past 3 weeks, seeing how a simple website has failed as miserably as it has?
Bill, number one on the doctor's list is the shrinking networks, meaning that I might not have the people to refer to that I'm used to. They may have dropped out. I might not have the orthopedist. I might not have the obstetrician, the psychiatrist. The other issue is, you might not be surprised to hear this, are shrinking reimbursements. We're worried about that, and we're worried about being paid for what's called quality of care if we have a positive outcome. But what if we have a negative outcome? And what if we have a patient with a lot of medical problems? All this concerns us. And our own hospitals may have trouble meeting bottom lines if they're flooded with people that don't need to be there.
It's endless.
Yeah, Dr. Marc Siegel,
a lot of concerns.
Yeah, absolutely. Thanks so much for explaining them to us.
Good.